So, Chris, I can't say who in the administration knew what and when, but I would say that that article reinforces what we've heard along the way, which is that many in the administration were very worried about this as early as January and February. And that seems pretty clear now. And I'd also say that if we had acted on some of those warnings earlier, we would be in a much better position in terms of diagnostics and possibly masks and personal protective equipment and getting our hospitals ready.
When you say be in a much better position, if we had imposed social distancing, stay at home at the end of January or in early February, would there be a dramatically smaller number of cases and deaths?
Yeah, I'm not sure we would have been able to get the collective political will to do it as early as January or February because we didn't really know when we had cases. But if we had done a lot of diagnostic testing earlier, it's possible we would have seen enough disease to get the will to do that in February. And yes, the earlier we put in place social distancing, the earlier we would have gotten to a peak and to a better place where we can start to think about responding.
Let's talk about where we are right now. The U.S. now has more than 500,000 coronavirus cases, and this week we had 2,000 deaths in a single day. So we keep talking about that curve. Are we at the peak of that curve or even on the downslope, as some public health officials are now saying?
It looks like in the last few days, if you look across the country and you average out the numbers, that we are near a plateau in the number of cases, which would be reaching a peak. And in some places like New York, which has had terrible disease, New York City, which has had terrible impact with this epidemic, we have had a few days of similar case counts day to day. And so that is what we might call a peak. It doesn't mean that the downslope of the peak is going to be fast. It could be that this plateau carries on for a while. And we've seen in other countries where they've started to have lower case counts over time that it can take days and weeks for the numbers to even get cut in half. So I think while we may be at a peak, we hope we are, it's still going to take time for us to start to bring the case numbers down, especially in places which are the biggest hotspots.
Well, let's talk about that. There are all kinds of models we're talking about. First, there was a model that 100,000 to 200,000 people in the U.S. would die from the disease. Now the latest model is 60,000. One, how reliable are these models, and what's your projection for how many deaths we're likely to see from the coronavirus here in the U.S.?
So all models are just approximations. They all have their strengths and limits, and so it's useful to look at many models and try and get a general sense of things. I think the model you're referring to has been one that the White House has been using, which has had lowered estimates of the total number of people who might die from this, which is a model that really tries to fit the experience of Wuhan, China onto the United States as a whole. I think it's good for an overall general estimate of what might happen, but in terms of specific days when things will happen or specific numbers, I'm not confident in any particular model. I think it's hard to see out beyond a couple of weeks. And I think one of the biggest factors is that it will depend on what we do as a country. This isn't preordained what the final outcome will be in terms of overall numbers. It depends on our collective reaction, what we do with social distancing, whether or not we develop therapies over time that work, our overall ability to track cases and to build public health capacity around the country. That's going to be crucial for us to try and get control of this over time.